Well, today we are learning about Bupe.Online, a telehealth platform used to treat addiction.
That's right, and here to tell us more today is Dr. Corey Richardson from ICGH Treatment Centers. Thank you so much for joining us.
Thank you.
Of course, and you know, last time we kind of talked about quality of care for people with addiction, and you know, we talked about how this treatment works. So if it does work, why are people still having issues, do you think?
Quality care does work, but the problem is getting people connected to the quality of care. Sometimes there are barriers like the cost of care or taking time away from work, and that sometimes is the problem. So we've created a Bupe.Online, a virtual platform. We saw so many virtual platforms out there that just offered Suboxone and not the other counseling and recovery supports that help people turn their life around, and that's the difference.
You just mentioned Suboxone, so how does it work? How does the medicine?
There's a lot of misinformation about Suboxone. It's a partial agonist antagonist, so it binds to the opioid receptor site, and that's the big part of heroin addiction or pain pill addiction. So it binds there, taking care of craving and withdrawal, but it also acts like a blocker, so that if somebody has some stress and they go back and relapse, they don't feel the euphoric high. So it's an important part of stabilizing somebody during treatment, but most of the people in our program do come off of that with the right counseling.
And low barrier, explain what that means a little bit.
So barrier or obstacles to care, like costs, like I don't have insurance, or I have insurance with a high deductible, or there's stigma around addiction treatment, so I don't want my local pharmacist, or I don't want to go to a treatment center. So it's some of those types of things that we take care of in a virtual platform.
Are there any other cases that you cannot treat?
Well, when we do our assessment, our initial evaluation, we do determine if they need to detox, or maybe they need to come to one of our centers or do intensive outpatient services. So initially, maybe a low barrier platform isn't for them, but after they stabilize, it's probably going to be appropriate for them as they come off the medication.
And you know, this is something that has come to the forefront across the board, and that's counseling. I mean, why is that so important in partnership with this?
So programs that just give medication, there's still the very high chance of just relapse. So you need to learn some drug-free coping skills, you need to learn address trauma, and then when you're coming off the medication, you need the recovery support so that when treatment's over, you can stay in lifelong recovery the rest of your life.
What about the online cost of that, Bupe.Online?
So that's the one thing that's really good about this program. Doctor visit, oral drug testing, counseling, intake, support, $120 a month. And we do take insurance as well, so if you have insurance and want to use your insurance, that's fine as well.
Okay, well, Bupe.Online, not .com. We want to make sure that's clear. Bupe.Online. Make sure to go there, or you can call 1-877-7-GO-BUPE. So thank you so much for joining us.
Thank you. They can get started today. Just go to the website and they go right into the scheduler.
Thanks, Dr. Corey.
Thank you.